Good day, class. I am teacher Vernajan Alpesada, your physical education teacher. Today, I will be discussing the emergency care and first aid. First aid kit. Class, when we say first aid kit, it is an emergency measure, generally consisting of simple, often life-saving techniques that most people can train to perform with minimal equipment and no previous medical experience. The term usually refers to administering care to a human, although it can be also performed on animals. It is not classed as medical treatment and does not replace interventions from a trained medical professional. First aid is a combination of simple procedures and common sense. For severe bleeding, take these first aid steps. Class, call 911 or your local emergency number if the wound is deep or you're not sure how serious it is. Don't move the injured person except if needed to avoid further injury. Before checking for the source of the wound, put on disposables, gloves, and other personal protective equipment if you have them. Second steps, remove any clothing or debris from the wound. Look for the source of the bleeding. They could be more than one injury. Remove any obvious debris but don't try to clean the wound, class. Don't remove large or deeply embedded object. And class, don't probe the wound. Third, stop the bleeding. Okay? Cover the wound with sterile gauze or a clean cloth. Press on it firmly with the palm of your hand until bleeding stops. Class, don't press on an eye injury or embedded object. Don't press on a head wound if you suspect a skull fracture. Wrap the wound with a thick bandage or clean cloth and tape. Lift the wound above heart level if possible. Fourth, help the injured person lay down. Okay? If possible, place the person on a rug or blanket to prevent loss of body heat. Elevate the feet if you notice signs of shock, such as weakness, clammy skin, or a rapid pulse. Calmly pressures and injured person. Fifth, add more bandages as needed. If the blood seeps through the bandage, add more gauze or cloth on top of the existing bandage, then keep pressing firmly on the area. Tourniquet. Tourniquet is effective in controlling life-threatening bleeding from a limb. If needed, apply a commercially made tourniquet if it's available and you're trained in how to use it. Don't use an improvised tourniquet such as a scarf or a belt. When emergency helps arrive, tell them how long the tourniquet has been in place. Sixth, keep the person still. If you're waiting for emergency help to arrive, try to keep the injured person from moving. If you haven't called for emergency help, get the injured person to an emergency room as soon as possible. And lastly, steps, class, wash your hands. After helping the injured person, wash your hands even if it doesn't look like blood got on your hand. Teacher, how do I treat a serious cut? Class, if the cut is severe and you can go to an ER right away or must wait for an ambulance, begin this treatment. Rinse the cut or wound with water and apply pressure with sterile gauze, a bandage, or a clean cloth. If blood soaks through the bandage, put another bandage on top of the first and keep applying pressure. Raise the injured body part to slow bleeding. When bleeding stops, cover the wound with a new clean bandage. Do not use a tourniquet. If the cut is bleeding, put a piece of sterile gauze or a clean cloth over the cut. Wear clean latex or rubber gloves if you have them. Apply pressure with your hand for 5 to 10 minutes without picking to shake the cut. Then, if the cut is still bleeding, keep applying pressure for 5 to 10 minutes more. If the blood soaked through the gauze, do not remove it. Put another gauze pad on top and keep applying pressure. If you can raise the bleeding body part above the level of your heart, do not apply a tourniquet. If the bleeding doesn't stop after 15 to 20 minutes, take yourself to the medical care or call 911. Clean and check the cut each day. Call your doctor if it is a red, swollen, tender, warm, or draining pus, or if you gets a fever. Antibiotic cream or ointment isn't needed for most minor cuts as long as they are kept clean as they heal. Doctors and nurses sometimes suggest antibiotic cream or ointment for some cuts. You can call the doctor's office to see if they recommend it for yourself. Stoppage of breathing. Cardiopulmonary resuscitation (CPR) first aid is vital for saving lives. A person can carry out first aid after a life-threatening incident or injury before the arrival or emergency services. There are two main steps in CPR: applying chest compression and then providing breaths. Apply 30 chest compression. The first aider should kneel next to the person who is injured. They should be lying on their back. Place the heel of one hand in the middle of the chest. Place your other hand on top of the first hand and interlace the finger. Push the chest down about 1.5 to 2 inches. Push the breastbone up and down to a depth of about 5 centimeters, about 30 times at a pulse rate of 100 beats per minute. Provide two breaths. Make sure the airway is open and pinch the nose so it closes. Gently raise the chin upwards with two fingers of your other hand. Take a deep breath. Seal your mouth over that of the person with injury and exhale into the airway. You should see the chest rise and fall. To get another breathing, lift your head and breathe in deeply. Perform steps 1, 2, 3, and 4 again. Repeat the 30 chest compressions followed by the two breaths about 5 times. And then check for normal breathing. If they are not breathing normally, carry on performing CPR. If breathing restarts as normal, stay with the injured person until help arrives. Chest compressions alone can be lifesavers. The crucial factor is time. Make sure you respond quickly. It is important not to let your hands bounce when performing chest compressions. Make sure the heel of your hand is touching the chest throughout chest compressions. Class, you might hear some pops and snaps during chest compressions. These are normal, so do not stop. Shock burns. The first step is treating the burn injury is determining whether the burn is a minor or major one. The determination will direct action and treatment. This is class the first aid kit for a major burn. The first step is treating a major burn is to call 911 or seek emergency medical care. Class, this is the steps to take until emergency arrives include make sure you and the persons whose burns are safe and out of harm's way. Move them away from the source of the burn. If it's an electrical burn, turn off the power source before touching them. Check to see if they're breathing. If needed, start rescue breathing if you've been trained. Remove restrictive items from their body such as belts, jewelry in or near the burn areas. Burn areas typically swell quickly. Cover the burned area. Use a clean cloth or bandage that's moistened with cool, clean water. Separate fingers and toes. If hands and feet are burned, separate the fingers and toes with dry and sterile, non-adhesive bandages. Remove clothing from burned area, but don't try to remove clothing that's stuck to the skin. Avoid immersing the person or burned body part in water. Hypothermia or severe loss of body heat can occur if you immerse large severe burns in water. Raise the burn areas if possible. Elevate the burn area above their heart. Watch for shock. Signs and symptoms are shock include shallow breathing, pale complexion, and fainting. Class, this is the first aid for a minor burn. Cool down the burn. After holding the burn under cool running water, apply cool or wet compresses until the pain subsides. Remove tight items such as rings from the burn area. Be gentle, but move quickly before swelling starts. Avoid pricking blisters. Blisters with fluid protect the area from infection. If a blister breaks, clean the area and gently apply an antibiotic ointment. Apply a moisturizing lotion such as one with aloe vera. After the burn area has been cooled, apply lotion to provide relief and to keep the area from drying out. Loosely bandage the burned. Use sterile gauze, avoid fluffy cotton that could shed and get stuck to the healing area. Also avoid putting too much pressure on the burned skin. Take an over-counter pain reliever if necessary. Consider Tylenol, ibuprofen, or Aleve. If if class faced with a burn injury, decisive action is important for the best possible outlook. Consider getting or building your own first aid kit. Check out first aid guide to get started. Poisoning. Poisoning is a cause by exposure to the harmful substance. This can be due to swallowing, injecting, breathing in, or other means. Most poisoning occur by accident. Immediate first aid is very important in a poisoning emergency. The first aid you can give to the person before getting medical help can save a person's life. It is important to note that just because a package does not have a warning level does not mean a substance in the package is safe. You should consider poisoning if someone suddenly becomes sick for no apparent reason. Poisoning should also be considered if the person is found near a furnace, car, fire, or in an area that is not well ventilated. Symptoms of poisoning may make time to develop. However, class, if you think someone has been poisoned, do not wait for symptoms to develop. Get medical help right away. First aid, seek immediate medical help for poisoning by swallowing and some inhalations. Check and monitor the person's airway, breathing, and pulse. If necessary, begin rescue breathing and CPR. Try to make sure that the person has indeed been poisoned. It may be hard to tell. Some signs include chemical smelling breath, burns around the mouth, difficulty breathing, vomiting, or unusual odors on the person. If possible, identify the poison. Do not make a person throw up unless told to do so by poison control or a healthcare professional. If the person's vomit, clear the person's airway. Wrap a cloth around your fingers before cleaning out the mouth and throat. If the person has been sick from a plant part, save the vomit. It may help experts identify what medicine can be used to help reverse the poisoning. If the person starts having convulsions, give convulsion first aid. Keep the person comfortable. The person should be rolled onto the left side and remain there while getting a waiting for medical help. If the person has spilled or on the person's clothes, remove the clothing and for inhalations poisoning. Call the emergency help. Never attempt to rescue a person without notifying others first. If it is safe to do so, rescue the person from the danger of the gas, furnace, or smoke. Open windows and doors to remove the fumes. Fracture. A fracture is a broken bone class. It requires medical attention if the broken bone is the result of major trauma or injury. Class, you need to call 911 or your local government number. Also call for emergency help. If the person is unresponsive, isn't breathing, or isn't moving, begin CPR if there is no breathing or heartbeat. There is a heavy bleeding. Even gently pressure or movement causes pain. The limb or joint appears deformed. The bone has pierced the skin. The extremity of the injured arm or leg, such as a toe or finger, is numb or bluish at the tip. You suspect a bone is broken in the neck, head, or back. Don't move the person except if necessary to avoid further injury. Take these actions immediately while waiting for medical help. Stop any bleeding. Apply pressure to the wound with a sterile bandage, a clean cloth, or a clean piece of clothing. Immobilize the injured area. Don't try to align the bone or push a bone that's sticking out back in. If you've been trained in how to splint and professional help isn't readily available, apply a splint to the area above and below the fracture sites. Padding the splint can help reduce discomfort. Apply ice packs to limit swelling and help relieve pain. Don't apply ice directly to the skin. Wrap the ice in a towel, piece of clothes, or any other material. Treat for shock. If the person feels pain or in breathing in short, rapid breaths, lay the person down with the head slightly lower than the trunk and if possible, elevate the legs. Sprain. Class, your ligaments are taut elastic like bands that connect bone to bone and hold your joints in place. A sprain is an injury to a ligament caused by tearing of the fibers of the ligament. The ligament can have a partial tear or it can be completely torn apart. Ankle sprains are the common type of sprain. The wrist, knee, and thumb sprains are also common. Sprained ligaments also swell rapidly and are painful. Generally, the greater the pain and swelling, the more severe the injury is. For most minor sprains, you probably can start initial injury treatment yourself. Follow the instructions for RICE. R means rest the injured limb. Your doctor may recommend not putting any weight on the injured area for 48 to 72 hours. So you may need to use crutches, a splint, or brace. Also may be helpful initially but don't avoid all activity. Even with an ankle sprain, you can usually still exercise other muscles to minimize the conditioning. For example, you can use an exercise bicycle with arm exercise handles, working both your arms and the uninjured leg while resting the injured ankle on another part of this bike. That way you still get 3-limb exercise to keep up your cardiovascular conditioning. I means ice the area. Use a cold pack, a slush bath, or a compression sleeve filled with cold water to help limit swelling after an injury. Try to ice the areas as soon as possible after the injury and continue to ice it for 15 to 20 minutes, 4 to 8 times a day for the first 48 hours or until swelling improves. If you use ice, be careful not to use it too long as this could cause tissue damage. C for compress. Compress the area with an elastic wrap or bandage. Compressive wraps or sleeves made from elastic or neoprene are best. The last, letter E, elevate the injured limb above your heart whenever possible to help to prevent or limit swelling. Sprains can take days to months to recover class. As the pain and swelling improve, gently begin using the injured area. You should feel a gradual, progressive improvement over the contour. Get emergency medical assistance if you're unable to bear weight on the injured leg, the joint feels unstable or numb, or you can't use the joint. This may mean the ligament was completely torn. On the way to the doctor, apply a cold pack. You develop redness or red streaks that spread out from the injured area. This may mean you have an infection. You have pain directly over the bones of an injured joint. You have re-injured an area that has been injured a number of times in the past. You have a severe sprain. Inadequate or delayed treatment may contribute to long-term joint instability or chronic pain. Strain, class, when we say strains, these are injuries to muscle or tendons which connect muscles to bone. Due to overstretching, sprain involves a stretch or a partial tear or ligaments which connect to bones. Sprains and strains happen more often in teens than in younger children. This is the signs and symptoms: pain in the joint or muscle, swelling and bruising, warmth and redness of the injured area, trouble moving the injured part. What to do? Make sure yourself stops activity right away. Think RICE for the first 48 hours after the injury. Rest the injured part until it's less painful. Wrap an ice pack or cold compress in a towel and place over the injured part immediately. Continue for no more than 20 minutes at a time, 4 to 8 times a day. Compression, support the injured part with the elastic compression bandage for at least 2 days. Elevation, raise the injured part above heart level to decrease swelling. Give yourself ibuprofen or acetaminophen for pain and swelling. So to get emergency medical care, if your child or yourself has severe pain when the injured part is touched or moved, continue trouble bearing weight, more bruising, numbness, or a feeling of pins and the needles in the injured area, a limb that looks bent or misspanned, signs of infection, increased ramp, redness, strict swelling and pain, a strain or sprain that doesn't seem to be improving after 5 to 7 days. Dislocated. A dislocated joint happens when bones are partly or completely pulled out of their normal position. Joints can dislocate where a strong force wrenches or pulls the bone into an abnormal position. This is classed as signs and symptoms. Someone with a dislocated joint may complain of a severe, sickening pain, be unable to move the joint, have swelling and bruising around the joint, and it may look shorter, bent, or deformed. What to do? Advise the casualty to stay still. Help them to support their dislocated joint in the most comfortable position. Do not try to put the dislocated bones back into its socket, as this may cause further injury. Stop the joint from moving. If you think they have dislocated their shoulder or elbow, support the injured arm using a sling. To give extra support, tie a broad fold bandage, wide bandage, around the chest and the sling if a hand or arm is injured. Remove any rings or watches in case of swelling. If you think they have dislocated their ankle, knee, or hip joint, support the injured leg using padding and broad fold bandages. Send the casualty to hospital. Call 999 or 112 for emergency help if you can take them yourself. While waiting for help, treat for shock if necessary. Monitor their level of response. Do not raise an injured leg, only raise the uninjured leg. Check the circulation beyond any bandages every 10 minutes and loosen if necessary. Bandaging. First aid, bandaging covering a break in the skin helps to control bleeding and protect against infection. Dressing are pads or gauze or cloth that can be placed directly against the wound to absorb blood and other fluids. Cloth bandages cover dressing and hold them in place. Step 1. Dress the wound. Put on gloves or use other protection to prevent contact with the victim's blood. Clean the wound with mild soap and water. Apply a small layer of topical antibiotics if desired. Place clean dressing over the entire wound. Gauze dressing let in air for faster healing. Non-stick dressing have a special surface that won't cling to the wound. If blood soaked through the dressing, place another dressing over the first one. Step 2. Cover the bandage. Wrap roller gauze or cloth strips over the dressing and around the wound several times. Extend the bandage at least an inch beyond both sides of the dressing. Don't wrap the bandage so tight that it interferes with blood flow to healthy tissue. Step 3. Secure the bandage. Tie or tape the bandage in place. And the last step, step 4, check circulation. Check circulation in the area below the bandage after several minutes and again after several hours. If circulation is poor, the skin may look pale or blue or feel cold. Signs of poor circulation also include numbness and tingling. If circulation is reduced, loosen the bandage right away.